population's age demographics in which the number of people over the age of 65 rises and the percentage of citizens under the age of 65 falls. The term age population refers to those who are 65 years old or older in a nation's people.
The number of Malaysians aged 60 and more is currently expected to be 1.4 million by 2020. The percentage of the population that is 60 years and over has increased over the years. Moreover, in 2021, the percentage of people aged 0 to 14 years old fell to 23%, down from 23.3% in 2020. Lower birth rates and a decreased total fertility rate are two variables that contribute to Malaysia's population aging. Falling birth rates and total fertility rate were due to higher education and late marriage. Late marriage leads to couples having fewer children. Increasing life expectancy is also factors of aging population in Malaysia due to excellent medical healthcare, good diets, and high quality of life. Lastly, mortality rate for the whole population began to increase slightly due to the increasing number of deaths from an older population.
As the percentage of the aging population in Malaysia increases, there are challenges of providing congenial living space and environment for elderly. Professor Nathan Vitsialingam, advisor to the Malaysian Healthy Aging Society (MHAS), acknowledged this, stating that one of the current issues is the lack of adequate elderly care homes provided by both the public and private sectors. Another issue that emerges is the lack of healthcare for elderly, especially geriatric services and mental health care. According to Professor Dr. Philip Poy Junhua from the Malaysian Society of Geriatric Medicine (MSGM), Malaysia has only 35 geriatric specialists at the current rate, with 2019 as the base year. Geriatricians are very important as they can help the elderly patients recover from any injury or disease in a long-term manner. Care and treatment are common services, but more significantly, the necessary assistance from the specialist is to enable and empower the elderly to be self-reliant. The last issue of the aging population in Malaysia is it might affect the economic growth, since the dependency ratio will reach 49.5% by 2040, which means that for every 100 productive employees, there will be 49.5 non-productive children and elderly who need their assistance. When the number of people who are not working grows faster than the number of people who pay taxes, which is inevitable in aging society, tax revenues will decrease and government spending will reduce. Thus, the GDP will also decrease.
Now, let's talk about the government policies, initiative, and its effectiveness. Because of the lack of elderly care homes, government have made a policy to solve the issue, which is the 11th Malaysia Plan. First, it is to enhancing targeted supported, particularly for underserved communities. Second, improving system delivery for better health outcome and expanding capacity to increase accessibility. And lastly,
collaborate with the public sector.
There are still a few problems such as inequalities and structural economic. To effectively respond to domestic and global difficulties, the implementation of all development efforts will need to be strengthened in the future. Moving on, due to the lack of healthcare for elderly, the government have implemented a policy called Voluntary Welfare Organisation. In Malaysia, there are 132 activity centers for older persons. These centers provide activities and socialism platforms for older persons to empower and maintain their well-being. The lack of funding in Malaysia can also be a problem, as most orphanage homes have a deficit compared to their expenses. Besides that, lack of volunteer staff. Malaysians are uninterested in volunteering because of the low pay, ineffective advertising package, and a long working hour. Furthermore, mismanagement. Having an experienced staff to administer the financial asset because of lack of knowledge. Finally, affect the economic growth because the dependency ratio will reach 49.5% by 2040. As a result of that, the government have implemented an act called Minimum Retirement Age Act 2012. It is not effective as, in July 2013, about 1 million job opportunities have lost for fresh graduates.
The aging of the population is a global issue that affects every country. What sets it apart is its readiness to deal with an aging population. According to the data, Malaysia is the 37th best country for elderly people to live in. with a healthcare index of 76.2 and happiness index of 5.34. In comparison to the first country, Finland, which has a healthcare rating of 75.27 and happiness score of 7.77, while Denmark, the Netherlands, Switzerland and Australia came in second, third and fourth respectively. Apart from that, according to Dr. Tan Maupin, Malaysia has 90 government-run aged care facilities, 350 registered aged care institutions and over 1,000 unregistered aged care facilities as of 2021. In comparison, in Australia, there are approximately 2,672 aged care facilities. Switzerland is one of the greatest countries for aged care facilities, with over 1,300 homes scattered around the country in 2001 and fast rising to the present day. Geriatric services are one of the most significant healthcare services for an aging nation. Unfortunately, there are just 39 geriatricians in Malaysia's public and private health facilities, with Terengganu, Kelantan and Perlis having none at all. The table represents the statistics of 5 countries with developed and managed geriatric medicine, with 49.6 geriatricians per million people. Italy came in first, followed by France, Belgium, Spain and Denmark. Next, a high total dependency ratio shows that the adult population have a greater responsibility of providing for the elderly. Malaysia has a dependency ratio of 10.4 when compared to the rest of the world. The United Arab Emirates (UAE) has the lowest dependency rate with only 1.5 elderly dependency ratio, followed by Qatar, Oman and Bahrain.
Next, I'm going to talk about Islamic perspective on aging population in Malaysia. Based on Quran, Surah Al-Isra verse 23, that means, "For your Lord has decreed that you worship none but Him, and honor your parents. If one or both of them reach old age in your care, never say to them, even, nor yell at them. Rather, address them respectfully." It is the Holy Prophet's teachings and the Holy Quran. Respect for your elders is a concept that allows you to develop a meaningful relationship with them. When you are older, your children will look up to you. This cycle of love and respect will then be perpetuated in your family for all time. There will be harmony in your home when there is love and respect. There will be peace in society if there is peace in your home. Your grandparents and other elders will teach you how to be a decent Muslim. Their presence will teach you to treat elders with respect in general. In order to respect the elders, we must taking care of them in a good way that make they feel comfortable. Government of Malaysia also must play their role. Malaysia should develop its own strategy for execution and serve as a model for others in preparing for an aging society where 7% of the population would be 65 or older by 2030. In accordance with the National Policy for Older Persons, effort should be made to empower its senior citizens, not just by focusing on the supply of physical infrastructure, but also by empowering them with education for spiritual strengthening. Furthermore, regulation governing the welfare of formal and informal caregivers must be revisited. Last but not least, Islam encourages young people to honor and respect their elders by doing good.